All right, thank you so much for staying with Daybreak. We're getting into a conversation with Dr. Alfred Mutua. He's the governor of Machakos County. He's joining us live from Machakos. Governor, thank you for making time for us. Now, Machakos now got the approval to test COVID-19. What is your testing capacity now, and how many have you tested so far?
We are capable of having what are called runs. So we can do 33 tests per run, which lasts about an hour and a half. So our testing capacity is about 330 to 400 in a day, working basically day and night. So that's the capacity that we have currently, but we want to build it up to get to close to 500 in a day. So far, we have completed full test of about 33 tests, which were the experimental ones that we are doing. Today, we expect to do about 100 tests as we move on, as we beef up our ability to test more and more people.
Do you have the confidence in all these testing kits? Because this has been almost a world over concern. The people are saying that there are false negatives, false positives. Are you concerned about the tests?
I mean, it's a concern when, President Magufuli said that papai, even we saw goats and cows, and something that I'm willing to do in Machakos also. I'm thinking that one of these days I'll go to the shamba and test a few cows and chicken and a few mangoes and send those samples to several labs. Our lab in Cambridge, lab in South Africa and others, just to quantify to make sure that the testing kits are okay. So far, so good. But the whole issue about COVID-19 is not even about testing. It's about patience. And so when you talk about a pandemic, if you look at, for example, New York, or you look at Italy, or you look at some of these countries, patients were falling sick. People would be walking, would be crawling into hospitals, seeking medical care. They can't breathe. So we are not seeing those cases in our community where people cannot breathe. So I think so far, I'm saying that the testing kits have some positive elements to them.
Okay, so you're willing to test the quality by getting samples from different places like what Magufuli did? And will you reveal those results to us?
But I won't just be testing it. Oh, yes. I'd like to do it actually. If we can collaborate with media houses, we'd like to do it together, and then we package those samples and we send them to different laboratories so that, we've got several laboratories in Kenya, we've got several laboratories outside Kenya.
Yeah.
So we can send those samples to different places and then compare the results. If they all come different, if they're all different results, then we'll panic. But if you're all the same, then we're on the right track.
Okay, that sounds like a good plan. But also, Governor, you've done more to ensure that you're ready for COVID-19. What else is Machakos doing right now to ensure that in the event that it's a full-blown outbreak, it would be handled properly in Machakos?
One of the things that we did is that we separated the people who might be infected with COVID-19 from other patients. As you know, my brother, is that when you're sick, when you have a headache, when you have a stomachache, when a woman is pregnant, when you break a leg, when you're not well, your white blood cells are very busy fighting that disease that you have. Your immunity is lowered. If you have diabetes, whatever, you're going to a hospital to be treated. A child is going to a hospital, acute and homa, the immunity is lowered. Therefore, if your immunity is lowered and you're in an environment where you've got COVID-19 patients, chances of getting infected are very high. That is why when we studied what happened in Italy, what happened in New York, we decided to isolate and separate COVID-19 patients from other patients who are going to hospital for what you can call, quote unquote, regular diseases. And so as a result of that, that's why we set up the Machakos Isolation Center, whereby we are able to do mass testing. People are able to come to the stadium, or in one part of the stadium, they go through what is called triage. They are measured, they are taken their samples. If they need to be taken their samples, it's taken to the lab. And whoever is found positive then is isolated in a place that is separate from the main hospital.
Okay. And so now, Governor, let's talk about the national approach now. What is your view on restaurants partially reopening? What do you think?
This is a catch-22 situation. And it is something that we need to think about further, because you had Mutai, the minister yesterday, Kagwe, speaking with an accent that reminded me of Mwai Kibaki, talking about how people would go and order one sausage and 2 or 3 beers, go to another place, order sausage, 2 and 3 beers. What we have a thirst for alcohol in this country. We have a thirst for misbehavior in this country. Somebody called me and told me that in some places in Nairobi, that people are just, it's going back to normal. People are just congested. There is no spacing. So I think it's a bit too early for us to be able to tell people to reopen restaurants. Because even before they reopen restaurants, we need to test all the people in the kitchen. We need to test all the people who are serving. We need to test the security. We need to test everybody who is handling the food, people who are washing the plates. Because you sneeze on a plate, you go, somebody touches on it. So we need to be careful. And I am not going to go to a restaurant myself at this venture. I don't trust the cleanness of any restaurant right now unless people have been tested and retested over a period of time.
And what about the restaurants in your county? What is your directive right now? Because I saw Governor Nyong'o saying that in Kisumu, the restaurants will remain closed.
Ours, they are remaining closed. For now, we are working on the policy. We'll have a cabinet meeting tomorrow. We had an emergency meeting yesterday. We discussed. I said it's a catch-22 because the service industry is suffering, and that's a large industry in our country. People are jobless. People have been told to go home. People have no money. So we have to find a way of cushioning and people reopening, but it needs to be in a slow, systematic manner. So we have set up guidelines in my county, which now we are going to have people apply to reopen their restaurants. And then we are going to send a surveillance team to that restaurant and watch, and they're going to prove to us that they can actually be able to operate. And what we are doing basically is buying time. This will give us another 2 weeks as the country gets into motion before Machakos restaurants are be able to open, because we don't want to go against the national guideline. You know, the president has said, let us open restaurants, we understand. So we don't want to be seen to be going against the national move. And because we have the capacity to test people in Machakos, we'll be able to roll it out, but in a systematic and slow manner as we watch how the rest of the country is responding to it.
Yeah, you've been quoted as saying that these are extraordinary times which call for extraordinary measures. What gaps are you seeing nationally that the national government is grappling with when it comes to dealing with COVID-19, and how different would you have done it?
As I said, and I want to repeat what you just said, there are extraordinary times that call for extraordinary measures, but also even more important, for extraordinary leadership. We have to do things differently. Our country is very bureaucratic. For example, it took a very long time for testing centers to be approved. I mean, if you go to many of the level 5 hospitals, Machakos being one of them, we have the PCR machines. If you can test for TB, you can test for COVID-19. Kisumu can test for COVID-19. So we should have moved with speed to ensure we've got more testing centers brought up to speed. We should have trained our people throughout the counties. So we need to get out of the mentality of a centralized government, which I've been speaking about. The national government still thinks of Kenya as a centralized country. We are a devolved nation, and we need to think about it in a devolved manner. So every county needs to be given the ability to work as if it's a country by itself, still in cooperation with other counties. So that was one of the first things. I think the lockdowns came a bit too late. I know that the curfew was okay, and the curfew is doing very well, even though the other night I was coming from a function where I knew I would be late, and my people knew I would be late, and I was driving home at about 7:30. I was in Nairobi at that time. And, you know, and cars in Nairobi are just driving around at 7:30, 7:45, 8 o'clock. We had an emergency meeting somewhere, and people have gone back to that system. So there is not real good enforcement in terms of the curfew. If you walk around this country, the distance, the spacing is not there. You know, people are really not are not spacing. Are not what is the right term there? They're not keeping apart from each other.
Social distancing.
So that is also the social distancing is not there. You know, people, you walk to the markets anywhere in this country. You know, in Machakos we are trying, and you see that. I'm seeing videos every evening from TV of 3 or 4 people in a boda. So I think the aspect of enforcement by counties and also by national governments have been quite weak. And we don't want to get to the place of other countries where you see bodies being dumped on the streets.
But Governor, how do you deal with the lethargy? Because the same people that you're talking about are the Kenyans who, when a bit of stringent rules are put in place, then it's very close to police brutality as well. There's a lot of complaints that come up. So how do you deal with the lethargy of the people who have been told to do something, but they're not doing it?
But Kenyans are very good. We are very lethargic, but also we are very reactive to law and order. You know, you don't have to beat people to pulp. But if, for example, it is declared that anybody who is caught walking in the streets, driving in the streets without good reason, at 7:01 will be put on quarantine for 21 days at their own cost. And this is done in one swoop across the country. I can assure you for the next 1 or 2 weeks, you will not find anybody out of their building or houses at 6:45. You know, the ability for us to follow directives and laws in these extraordinary measures make a difference. I was watching a video this morning about how Taiwan has reopened the economy. Why? They don't have any more infections. They had about 400 plus people, 6 people died because everybody complied. People wore masks. If you drive around this country, you'll find people are not wearing masks. Some are wearing masks, but they are wearing, they have them down here, and, they're not covering the essential parts, which is the mouth and the nose, and they're walking down the streets. This disease has been seen and has been shown to have airborne capabilities. That means, Trevor, if you're walking down a road, somebody coughs and passes away and goes on with whatever they're doing. If you pass by that route, within 8 minutes, those particles are still in the air. You don't see anybody, but those particles are still in the air. That means you can actually get infected. So we also need to be able to educate our people to understand why they need to put on masks, but people also need to be encouraged to be able to comply.
But do you think then the solution is a total lockdown? Because it seems the curfew is not working.
No, the curfew is working to some extent. I just think that the enforcement of the curfew needs to be better. But total lockdown is very dangerous because we also an economy. You know, we have to think about people eating. We have to think about the capacity. We have to talk about feeding people. You know, people have been talking that we can feed people. Come on, Yawa. How? You know, this country, Kenya, has been unable to feed its people during difficult times. When people have been starving, we see pictures of starving babies when we don't have corona. We are not capable of feeding people during normal times. We will not be able to feed people during these times. We are a poor economy because of squandering of our, of our economy and our money and corruption, and also because we are in the wrong. I always say that we use the wrong methodology. We are still stuck to the 1963 methodology of, building our country. And so as a result, we are still a poor country. Countries like Singapore that were poorer than us. Countries like South Korea that are making, Samsung phones, making LG, making, cars called Hyundai, were poorer than us. You know, when Jomo Kenyatta died on 22nd of August 1978, those countries are actually giving their people a cushion. In Australia, every household is getting close to 100,000 shillings every month as a cushion. In this country, we are not able to. Watu wanafutwa kazini, uko peke yako. So a total lockdown here would cause chaos. We are not capable because of our history, where we've not really been able to build the economy properly because we're using the wrong methodology and we elect politicians, not leaders.
So, and that's where I'm stuck, because right now I'm wondering, so what are the practical options are there if it's not a total lockdown? The curfew is there, it's being violated. People are being told to wear a mask. They only wear a mask when they meet the police. How do you deal with self-indiscipline of an entire nation?
I think if we pushed on enforcement, if the first thing I would do is push on enforcement. And the president needs to come up and say, okay, we have 1 more week. If we see people with border borders, 3, 4 people border borders, if you're not complying, then you move up the curfew. You say now you don't get out of your house until 9 o'clock. You get back home by 3 o'clock. People realize this is serious because people don't like lockdowns. Eventually, you work your way to a total lockdown if called upon. But once people realize there's a reward and punishment system and there's clear enforcement, it works. Look at our border points, Our border points now are covered by GSU. Why? Because initially, when the other police were covering, the regular police, there was a total bribery. People are sending me pictures where they bribe somebody 200 shillings and they're able to cross the border, this lockdown area. So they had to deploy GSU officers who are very strict, who are not being bribed. And so we need to understand the psychology and the culturalization of our society that tends to try to get away with everything, and then we enforce.
You've spoken right now and said that the problem here is that we elect politicians and not leaders. But there are many people who go to the polls and they say these are the people who are presented to us. So how then
Yes.
how do they sift the chaff from the wind, so to speak?
I think we need to look at people who can work. We need to look at history of people. We need to get our country, and this is where the media come in. We need to educate our people as to what are the qualities of a leader that can change your life. What does a leader need to be? Is it a tribal chief? Is it a person who's just been there forever? We need to elect people because this cocoon of tribalism that has been there with our parents, parents, need to change, especially with the new generation. Our census shows us that 75–80% of people in Kenya are young. Let's get this tribal thing out of it. For example, Trevor, if your child or your mother or your father or your uncle or your brother or sister has been involved in a road accident and they are bleeding profusely and need to be, to be taken to theater. When that person is being taken to theater, you've rushed them to hospital, you've gone to the hospital, they are bleeding to death. When they are being taken to theater, do you stop the doctor, the surgeon, and say, we ngoja kidogo, we ni kabila gani? We ni wetu kweli? We ni kabila gani? We nurse, we ngoja kidogo, we ni kabila gani? We unaishi wapi? We ni chama gani? We don't, because you want the most qualified people. And if you are told, by the way, huyu ni Mkamba kama wewe, lakini yeye si qualified, kuna Mjaluo hapa, huyu ni more qualified, ama kuna Mkikuyu hapa, ama kuna Meru hapa, ama kuna Mgiriama hapa, ama Msomali hapa, they are more qualified than your tribe person. Unataka mtu wa kabila lako, ama unataka ule daktari ataokoa mama yako? What do you choose? You choose the person who is most qualified regardless of their tribe. So we have to break away from this neo-colonialism system that has been ingrained in us about tribalism when it comes to electing our leaders. Because I always say, for example, if somebody is not able to play in the minor leagues, how can they play in the big leagues?
Yeah, and you've seen all the dailies having very different headlines now. And I don't even want you to mention the names, but are you confident in any of the current leadership?
No, we are not. And that is why some of us are putting ourselves out there and saying that come 2022, we need to have a generational change. And this is out of respect because, my brother, let's look at, even when you look at COVID and you look at why Singapore, that was poorer than us, actually in a position to lend Kenya money. It is because when you look at our system, has always been a pre-colonial system. Our first president, Mzee Jomo Kenyatta, was locked up for many years. That is pre-independence. And he became our first president. Oginga Odinga refused to be the prime minister because he said until Kenyatta comes out of prison, pre-independence. Our second president, Daniel Arap Moi, was in the Legislative Council, the colonial government of the time, pre-independence. Our third president, Mwai Kibaki, was the Secretary General, Executive Secretary of KAU before it became KANU in 1960s, pre-independence. Raila Amolo Odinga is a product, he's the son of Oginga Odinga, and he's been very active in bringing democratization to our country, trying to put that final foundation of independence. Uhuru Kenyatta is the son of Jomo Kenyatta, the roots of pre-independence, and him and William Ruto have participated in trying to put a foundation. So these leaders that we've had since independence have been basically putting a foundation in this country. Yeah. And they have done a good job. But Trevor, let me ask you, you're an educated man. When you finished Form 4 and you passed, you have to respect the teachers who taught you up to Form 4. But do they accompany you to university to study law or to study journalism? No, they do not. So Kenya has reached to a place where we're telling these leaders, you've done well. You've done well, Jomo Kenyatta. You've done well, Moi. You've done well, Mwai Kibaki, Uhuru and Ruto. All of you have done well. But now Kenya is moving to the university. You can't go with the same teacher. And that is why some of us have to come out and say, it is time for us to take over leadership in this country, have people engaged in a way that they can actually build an economy where people have money in the pocket. And then we don't have to worry about these problems of poverty all the time.
So picture this, Governor. We are at this particular state right now, 535 cases of COVID-19 and counting, 45 in just 24 hours. If you were the head of state, what would you have done differently?
I have to give credit to President Uhuru Kenyatta. You know, when all is said and done, I think he moved swiftly. He took this very seriously. Kenya reacted very, very well. We started the simple lockdowns. We got into all these measures of the things that should have been done. I think should have started the testing across the board, could have started much earlier. We could have started testing people much earlier. The curfew should have come much earlier. I'm quite worried about Mombasa, for example. It seems to be getting out of hand. We've seen now what is happening here in Nairobi, now in Isili, which we are very worried because it's very close to Mavoko, it's very close to Machakos. So we are monitoring those things. The flights should have been suspended much earlier because this is a disease that came from outside Kenya. And when we started allowing flights to come to this country, we're in actual fact allowing the disease to come back to this country. So we should have stopped the flights from coming to this country. We should have started the quarantine system much earlier than we did.
Okay. And so right now, the other concern that many people are wondering is, should there be a total lockdown? Can you sustain the people of Machakos? Are you able to distribute food to all of them?
We are not. We're not capable of having a lockdown right now. We cannot be able to feed people. In Machakos, it is better. In the rural areas, I think it is okay. You know, and I always watch nijipigia debe kidogo, Trevor, because you've asked the question. You know, it is essential for each area to be able to be self-sustainable or to have a self-sustainable system. When I got into Machakos, we were in the food relief list, where every season, when there was shortage of rainfall, we were given food. It's embarrassment. When I got in as governor, I realized that the country of Israel, the country of Jordan, Lebanon, receives less rainfall than Machakos County. So I bought tractors for every ward. I started giving our farmers free seeds, subsidized fertilizers, free chicken to our mothers. And as a result of those measures, the 400 plus dams and wells that we have dug, the borehole, the 500 kilometers of pipes that we've laid, as a result of that, Machakos is no longer in the food relief list. So we are capable of feeding ourselves now in Machakos, and in 2-3 years, we'll be able to feed the country because of leadership measures. So the rural areas for now are okay, but the slum areas, the town areas, Mavoko, Machakos Central, we have a problem. And so we have mapped out vulnerable families. We have about 4,950 vulnerable families that we need to feed. And we've had people come. The other day, we had banks like SBM Bank. We had organizations like Shelter Afrique, Mombasa Cement, leather company in Alfarama in Mavoko. They came, and other organizations, including the teachers, and they gave food. And so I'm calling upon other organizations that would like to come and support us in Machakos. Please come, we are ready. Please support us so that you can stock this food for our very vulnerable families, so that nobody in Machakos, we don't want to keep you safe. You don't get COVID and then you die of hunger. So we are asking you to come and help us so that you can be able to feed our people.
All right. So, Governor, quick question. You've seen the budgets by the Ministry of Health, and you've handled budgets before in your county, and I know you're not the accounting officer for them, but from an outsider looking in, does it make sense?
Well, you know, when I served as a national government spokesperson for President Mwai Kibaki, we had many scandals, many of them originating from Mafia House. Sorry, I mean Afia House, because we used to call it Mafia House. And it has been known, Afia House has been known to be a place of massive corruption. I mean, we've got some very, very good people working there, but it's a place of deals. And it's a place where when money goes there, everybody are looking. You know, the pharmaceutical industries and everything, bribery and misuse of funds are critical. And so the minister has his work cut out for him. He has to go there and change the system. Because, you know, yesterday we were in a session with senators discussing about whether devolution, whether healthcare should go back to national government. And you see the clamor by the national government to get healthcare back to where we were before, when people were dying in the streets. You know, when I got into Machakos, for example, we had 6 ambulances, 4 on top of rocks, and 2 did not have fuel. People are dying in the streets. Now, every administrative location in Machakos, 75 of them, we have an ambulance. Our hospitals are clean. We have a Machakos Cancer Center. We are treating people well. Devolution has changed healthcare. You go to Kisii, for example. You go to Kisumu. You go to Mombasa. You go to even Mandera, Wajir. Things are being done that have never been done. But the clamor to take back healthcare to national government is because they want to eat. is because the healthcare is big money. They are not caring about dying mothers. They're not caring about treating cancer. They don't care about management. You cannot manage doctors. You cannot manage healthcare workers if you're sitting in Nairobi and the doctor and the clinic officer and the nurse is in Wajir. You cannot. You need to have somebody locally elected to be able to manage healthcare. And that's where devolution comes in. So what we are seeing, I don't know whether it's true or not. I don't know whether it's propaganda, but I tend to lean on the fact that I think it is true because they have a history. They have a history.
All right. Thank you so much for making time for us. Dr. Alfred Mutua, Governor Machakos, speaking to us live from Machakos there. Thank you so much for speaking to us on COVID-19 and the preparedness. He says they're able to test about 300 to 400 per day as we speak. But he says that also the bureaucracy is clawing back on the achievements that would have been done in the healthcare system. All right.